Hello, my name is Marcos Borges, and today I am going to talk about evidence for camel-to-human transmission of MERS coronavirus. Definition: Middle East Respiratory Syndrome is a viral respiratory illness caused by a new coronavirus. The coronavirus causing Middle East Respiratory Syndrome, or MERS-CoV, that was first detected in Saudi Arabia in 2012. MERS are fever, cough, and breathing difficulties. Pneumonia is common but not always. Gastrointestinal symptoms, in particular diarrhea, have also been reported.
Our conversation on MERS continues in today's Health Edge. At least 3 people in the U.S. have contracted the virus, and there's still so much we don't know about this illness. Dr. Victoria Dooley of St. John Providence here now. And doctor, talk about what it is. What is MERS?
MERS is a virus, and MERS stands for Middle Eastern Respiratory Syndrome. It's in a family of viruses called coronaviruses that we know from illnesses like SARS, and even the common cold are in the same family of viruses. However, this virus is new. It came up in about 2012 in Saudi Arabia, and we're not quite sure where it came from as of yet, and there's no cure as of now, which is kind of concerning and scary.
And what does it do to you?
It causes a respiratory illness like a flu or a pneumonia with fevers, chills, shortness of breath. And those symptoms can be so bad that you end up in the hospital either on a breathing machine, some type of life support if it gets really bad.
Goodness.
Yeah.
And we were told that the gentleman in the U.S. who contracted it didn't even know he had it. Passed maybe through a handshake.
He didn't. So we're still learning about this virus.
Okay.
So out of the cases that we know about currently, about 30% of the people have died from it who contracted it. However, this gentleman came in contact with somebody who had a severe form of illness. And so when they chased him down to see if he had it, he initially didn't have all the symptoms, but they found out that he had developed antibodies to it. So, but fortunately, he wasn't severely ill from it, and he's healthy. The scary thing is that even if you don't travel outside the country to Saudi Arabia, you do want to protect yourself if you've been in situations with people who have. So if you or anyone you know have been in close contact with, have traveled to Saudi Arabia or any of the neighboring countries, within 2 weeks, you want to be on alert. So you don't want to blow something off as a cold or a mild flu. If you have been to Saudi Arabia or been around anybody who has, within 2 weeks of developing symptoms, do not blow it off. Go to your doctor right away and get tested.
Okay, and the regular things apply, like washing your hands, the sanitizer. Would that help?
Of course,
Okay.
as with anybody. And healthcare workers are at the most risk right now.
Okay.
And so they're trying to come up with some ideas to make them safe, because it's the healthcare workers, the doctors and nurses who are traveling overseas and coming back who are going to be at risk of spreading it to others. So it's kind of scary.
Oh boy, we'll keep our eye on it, Doc. Thank you so much.
Issue applied in medicine. MERS-CoV is a new identified human coronavirus that has recently emerged in the Middle East regions. Current epidemiology data suggests multiple zoonotic transmission from an animal reservoir leading to human infection, sometimes with secondary transmission events in humans.
MERS is a disease caused by the Middle East Respiratory Syndrome coronavirus, or MERS-CoV as it is commonly referred to. Although the full name is quite long, it actually says a lot about the virus. Firstly, the disease was first reported from Saudi Arabia, a country in the Middle East, in 2012. It causes a respiratory syndrome, which means that it can cause a range of respiratory symptoms. Thirdly, it is a type of virus called a coronavirus. So what is a coronavirus? Coronaviruses are a large group of viruses. They can cause a range of diseases in humans and animals, ranging from the common cold to diseases like SARS or MERS, which cause serious illness. The viruses are made up of a core of genetic material surrounded by an envelope, which has little protein spikes. This gives it the appearance of a crown. Crown in Latin is called corona, from which the viruses get their name. Let's have a look at MERS-CoV. Since its discovery in 2012, there have been about 1,180 cases and 483 deaths from MERS-CoV reported by the end of May 2015. All MERS cases have been linked to countries that are in or around the Middle East, either in those who have lived or traveled to those countries, or those who have had close contact with someone who is sick with MERS. There was an outbreak of MERS-CoV in South Korea triggered by a traveler from the Middle East. The outbreak was associated with healthcare facilities, and between May and July 2015, there were over 180 cases reported. No one is entirely sure where the virus comes from, but the likely source is camels. This is because evidence of MERS-CoV infection has been found in camels, and also that some people with MERS have reported contact with camels before they got sick. The role of bats in MERS infections is still being investigated. The virus is passed from person to person where there is close contact, but is not thought to be highly infectious. Transmission of the virus has occurred among family members and in healthcare settings where it has spread to healthcare staff and other patients. It is likely to be passed from person to person through the air or through direct contact. Once the virus infects a person, it can take between 2 to 14 days for symptoms to start. What are the symptoms? Well, it could range from having no symptoms at all to having severe respiratory illness leading to death. Symptoms typically include a fever, cough, sore throat, muscle and joint pain, and shortness of breath. Other symptoms may include diarrhea, nausea, and vomiting. People can get pneumonia, which can be quite severe. Those at the severe end of the disease usually require treatment in an intensive care unit. Although MERS can affect anyone, those who are at most risk of MERS are those who are older, have weakened immune systems, and those who have chronic diseases like diabetes, heart, and chronic lung disease. About 40% of people with MERS have died. So how can we tell whether someone has MERS or not? MERS is usually diagnosed by a test called PCR, or polymerase chain reaction, on respiratory samples like a throat swab or fluid from the lungs. This test identifies the virus based on its genetic fingerprint. Blood can also be tested to look for antibodies against the MERS virus. There is no specific medication for MERS. The main treatment for MERS is supportive care. There is no vaccine to protect against MERS. Travelers to MERS-affected countries with underlying chronic illnesses like diabetes, chronic lung disease, kidney failure, and immunosuppression are at a high risk of complications if they get MERS. Therefore, until more is known about how the virus is transmitted, it has been recommended that they should avoid close contact with camels and consuming raw camel products. To prevent spreading the infection, patients with MERS should be isolated appropriately, and those caring for them should wear necessary personal protective equipment. More information on MERS-CoV can be found on the
Pros and cons. Among the serious complications are renal failure and acute respiratory distress syndrome with shock. Patients with severe immunosuppression may have atypical signs and symptoms. There is no vaccine for this disease.
So you recently returned from a family vacation to the Kingdom of Saudi Arabia, and you have developed a slight cough. You snuggle into your sofa with a bowl of chicken soup and turn on the evening news. To your surprise, the top story highlights recent panic over a new deadly viral infection called Middle East Respiratory Syndrome, MERS or MERS. Should you call your doctor? Should you call an ambulance? Or should you simply tuck yourself into bed after 2 ibuprofen tablets and ignore the news altogether? Like any self-proclaimed medical genius, you search the internet for appropriate YouTube videos on the topic of MERS to alleviate your concerns. Apparently, Middle East Respiratory Syndrome is caused by a coronavirus, which is a large family of viruses that cause disease in humans and animals. This is the same class of virus that caused severe acute respiratory syndrome, or SARS, in recent years. MERS was first detected in April 2012. Infection with MERS causes death in about half of cases. Okay, that is frightening. You read on. The symptoms of MERS include cough, fever, and shortness of breath. Severe cases may progress to pneumonia and may include diarrhea, kidney failure, and death. There's that word death again. Now you feel a little nauseous. As the name implies, the origin of the virus seems to be the Middle East, including your recent vacation spot, Saudi Arabia. Recently, there have been documented cases in Europe, and as of May 2014, the United States had 1 documented mild infection. These cases occurred in people who had recently traveled to the Middle East. Scientists investigating the origin of the virus believe that it may have originated from domesticated camels. You recall several fun nights of disco dancing with Marcus the camel and begin to have some regrets. On a more serious note, MERS coronavirus can be deadly, but let's keep things in perspective. First of all, most strains of coronavirus are mild. Some strains of coronavirus cause the common cold. You have likely had a case of coronavirus yourself. Other common viruses, such as influenza, can also be very severe at times. What makes MERS potentially dangerous is the fact that it is new to humans. It is rare for viruses to pass from animals to humans, and the human immune system may not be prepared for such a novel virus. There is no specific treatment for MERS, but fortunately, most cases passed from person to person are mild. So far, spread of the virus has been very slow. So unless you are a doctor or a nurse that recently cared for patients in the Middle East with known cases of MERS, your cough and fever are probably caused by another virus. But don't take my word for it. Talk to your doctor if you or Marcus develop any unusual symptoms.
Applications in medicine. There is little information so far about the reservoir and the transmission mechanism. There is only limited evidence of interhuman transmission, transmission by respiratory drops of more than 5 microns and by direct contact with infected secretions. Because at the moment there is no has detected sustained community transmission.
Here are 5 things you should know about MERS. MERS, or the Middle East Respiratory Syndrome, is a viral respiratory illness that is caused by a coronavirus and was first identified in humans in Saudi Arabia in 2012. MERS is a zoonotic disease, which means that it is transmitted between animals and people. Dromedary camels, or one-humped camels, are the reservoir host for the MERS virus, and they are the main source of infection in humans. Infection can occur through either direct or indirect contact with infected dromedary camels. Human-to-human transmission is possible. There has been limited human-to-human transmission among family members in households. However, human-to-human transmission has repeatedly shown to be amplified in healthcare settings, especially when infection prevention and control measures are inadequate. Signs and symptoms of MERS are non-specific, with a clinical spectrum ranging from no symptoms or mild respiratory symptoms to severe acute respiratory disease and death. This makes it difficult to detect cases early and may lead to delays in isolation, testing and care, and the spread of the disease between people in healthcare settings. Currently, there is no specific treatment for MERS. It is supportive based on clinical presentation. Infection prevention and control measures are critical to prevent the spread of human-to-human transmission in healthcare settings. They include standard precautions and triage procedures for all patients. Droplets and airborne precautions are required when performing aerosol-generating procedures. For more information about MERS, please visit the MERS page on WHO's website or consult the Infectious Disease Handbook.
Conclusion. After the notification by the World Health Organization of the new coronavirus MERS-CoV, the importance was reiterated current emerging viruses and their relations, shifts with public health and wildlife. The species jump was evidence and the human-to-human transmission generates concerns and uncertainty. Therefore, interdisciplinary and intersectoral work should be planned and consolidated to deal with the study. The monitoring of the MERS-CoV is challenge and adaptation as well as possible reservoirs and secondary guests, and also of the prevention and mitigation measures to prevent and control the spread of the disease. Thank you.